Before I introduce Greg Owens, our featured speaker for this morning, I also want to thank Dr. Henry Neely in joining us this morning. And as I mentioned, CDPHP has been a fantastic supporter and partner to LaSalle School in creating and supporting the ACES Symposium. Dr. Neely joins us from CDPHP to provide a few opening remarks. And as we prepare to hear from Dr. Neely, I just want to provide a more formal introduction. I've had the pleasure of meeting and speaking with him quite a bit in the last several weeks as we've prepared for today's session. And I'll just share that personally, I found him to be very warm, very engaging, and very dedicated to the field, and I'm pleased to have him here. Dr. Neely joined CDPHP in April of 2020 and serves as medical director for pediatrics. In his role, Dr. Neely oversees the distinctive health needs of CDPHP members ages 21 years of age and younger, while also working with the corporate leadership team on medical management, quality improvement, and resource management initiatives in accordance with regulatory accreditation and corporate policies. And Dr. Neely, I want to thank you for joining us today, and I understand you have some remarks about the specific impacts of COVID on the pediatric population, children, and communities, also a highly relevant and poignant conversation for this morning. So without further ado, I'll hand it off to my colleague, Dr. Henry Neely. Thank you, Doctor.
Good morning, everyone. I assume you're hearing me okay. Thank you, David, for that, and thank you for so many people joining us today. Again, I'm Dr. Henry Neely, and I am, let's just say, a long-time practicing primary care pediatrician in the area. So I'm here today representing CDHP. As David said, I just recently joined as their pediatric medical director. This is my fourth symposium, but this one's a little different for me, as I'm not just a face in a large crowd, but I'm speaking, so I do apologize for any nerves. The other obvious big change is we couldn't be together in one big room, and instead of we're huddled in our offices, and as I am in my home, I was told to dress up, so it was an excuse to break out some of the pre-pandemic clothes. So a huge thank you to David Wallace and his staff at LaSalle for realizing the importance of this issue and making it happen despite the pandemic. I am extremely proud to represent CDPHP as the sponsor, as it shows just how important they also view this topic. Some people probably wonder why, but as we've learned in past conferences, trauma to a young child results in toxic stress that can ultimately lead to profound lifelong health consequences. At least 5 of the leading causes of death in the United States are correlated with higher ACEs scores. These include heart disease, diabetes, and cancer, which are the chronic conditions that are the big drivers of healthcare costs today. What I did want to briefly talk about that David mentioned is about how the COVID pandemic and the current recession have compounded the problems of ACEs. The fear, the social isolation, lifestyle changes, and financial strains has exacerbated the stress in the families we all serve. We have seen that manifest here at CDPHP, as there's been a 25% increase in claims for mental health and substance use disorders. We've heard a lot about the data that children are much less likely to get seriously ill from the coronavirus infection, but children have been very deeply impacted. A recent United Hospital Fund survey found that 1% of children in New York State have lost a parent or caretaker, with twice that rate in Black and Hispanic children. On top of the devastation of losing a parent, at least 50% of these children are at risk of entering poverty. In addition, approximately 25% of children in the state had at least one parent lose a job. And these children also are at risk for entering poverty. And none of these studies can also take into account the loss of education, both formally in school and informally via social interactions, as well as the loss of the many supports that daycares and schools provide children. this will have some significant impacts on children's development. Very importantly, however, it has disproportionately affected families. COVID itself is a much more severe disease in disadvantaged groups, and they are much more likely to be exposed to the virus. The recession has also been very disproportionate. The Robert Wood Johnson Foundation found that 60% of households with children in the US are facing serious financial troubles, with rates increasing to 66% in Black households and 86% in Latino. The deep disparities in wealth, education, and healthcare, as well as the racial and ethnic inequalities that were already prevalent in our area, have only increased. So what can we do as a community, since so many of these issues can only be solved as a society and as a nation? Awareness of the inequalities has increased, but we all need to keep getting the word out today, as we're doing as we speak. At CDPHP, we've been making great efforts to address the social determinants of health. We're also trying to break down the barriers that have long existed between the behavioral and physical health fields. ACEs are the perfect example of how we need to work together to address the social, behavioral, and physical determinants of health in order to truly make a difference. Very importantly, CDPHP intends to continue to support each of you. We know that so many of the people that are listening today have been working tirelessly trying to improve the lives of children and families that have been impacted by ACEs. On behalf of CDPHP, I want to personally thank each of you. If there are any other ways we can help, please let us know, let me know. I wanted to say, if you ever do feel frustrated or burned out by all your efforts, please remember one of my favorite Mr. Rogers quotes: "Anyone who does anything to help a child in his or her life is a hero to me." It certainly often has made me feel better at times. Again, anyone who does anything to help a child in his or her life is a hero to me. Lastly, near and dear to my heart as a pediatrician, I urge everyone to also put an emphasis on prevention. While it's critical to help children and families already affected by ACEs to be more resilient, and obviously this is important in improving children's outcomes, in preventing future trauma and generational abuse, but I still feel it's inherently wrong to expect children to just be tougher. I believe all children deserve a safe, loving, healthy, and happy childhood. So let's make that our real goal. It looks like we have a great program today. I've not heard Greg Owen speak, but I've heard great things. I must mention that Adam Foss was the keynote speaker at our National Pediatric Conference several years ago, and found him truly inspirational. So it's an honor to have him speaking. And so please, everybody, enjoy the symposium, and thank you again.
Thank you, Doctor. I appreciate that. And it's great to have you out of the audience and up on the virtual stage this morning. Thanks so much for joining us. And once again, I appreciate everything that you have done for LaSalle, for the symposium, and everything that CDPHP has done. I appreciate that deeply and sincerely. Changing gears slightly, and this question came in pretty early on, Doctor. It's for you, and it's related to your conversation about the impact of COVID on our youth and communities. Given the profound impact that it's had, both just as primary illness, but also secondary loss, the question came in: should COVID be considered a marker or kind of additional consideration when we're talking about adversity exposure for children? Any reflections on that, Doctor?
Well, it obviously has been a severe stress, a severe adversity for all of us, and especially, like I pointed out, families with children. And, the studies that defined ACEs and showed the impact of them were done on specific things. And So in addition to the stress of the pandemic itself and the recession, but all the other ACEs that make up the score certainly have been impacted. You know, there's certainly more violence going on in homes. Kids are exposed to more violence. I mentioned the, loss of parents, and certainly the entering poverty themselves have changed the ACEs scores on everybody. But I think in retrospect, it may be certainly a pretty big contributor.
Thank you, Doctor. I appreciate that. This question comes, and I believe it's directed toward Adam primarily, but I'll let other folks respond as well. How might you suggest we help young people address their trauma when they're tentative about engaging in counseling or programs because they've adapted to systemic oppression by trying to avoid the very system that is, in theory, designed to help and heal?
Yeah, this one is so meaningful. And again, I think it goes back to education and early education. I was in Detroit